Welcome to SVG-TV News for Thursday, April 24th. I'm Jimmy Prince with the details. Health officials here today confirmed that there are 3 confirmed cases of the vector-borne chikungunya disease in St. Vincent and the Grenadines. In declaring an outbreak of the disease in this country, Minister of Health, Wellness and the Environment, Clayton, Burgin, at a media conference earlier, says the country has now become listed among the countries in the region to record confirmed cases of the disease.
The confirmation was made from the clinical specimens which was sent to the Caribbean Public Health Agency, CARFA, on April the 17th, 2014 for the required testing. Of the 4 samples sent, 3 have been confirmed according to an official advisory sent by the Caribbean Public Health Agency, CARFA, and received yesterday afternoon, Wednesday. The 3 confirmed cases are on the Grenadine island of Beckley, 2 restaurant employees and a member of the non-clinical staff at the hospital. Although there are only 3 confirmed cases, I have been advised by the professionals within this ministry that these are sufficient to now declare an outbreak of the vector-borne disease.
And Medical Registrar and the Chairman of the National Surveillance Committee in the Ministry of Health, Dr. Rosmond spoke of the measures the ministry has implemented to manage the spread of the chikungunya virus.
We have a system in place that monitors surveillance for all infectious diseases. It is through this surveillance committee that we were able to detect, we were able to confirm, and we were able to treat and respond adequately to the cases that we have now confirmed. We have strengthened this system to include chikungunya surveillance, as mentioned before, since chikungunya is new to us. And in so doing, what we have done is that we have prepared a manual for healthcare personnel from the surveillance committee that will guide us in managing the disease. We have also consulted with key stakeholders, which are the lab, the surveillance officer, vector control unit, etc. Since late last year, we have circulated information to healthcare personnel and also to the general public on its signs, its symptoms, and its treatment.
Meanwhile, Medical Registrar in the Department of Primary Health Care and Environment, Dr. Franklyn James, says chikungunya generally presents symptoms such as fever, severe joint pain, muscular pain, headache, nausea, vomiting, fatigue, and rash.
I know in these conditions, anybody who has a fever may start thinking that, do I have chikungunya or not? At the same time, one does not have to have all these symptoms for us to suspect chikungunya. But the joint pain is a characteristic. So, in most cases, just fever without pains, although you may be concerned, but most likely it may not be chikungunya.
Dr. James further explains that there are 3 phases of the chikungunya disease, with 2 being of major importance.
The acute phase, and the acute phase indicates that between the 2nd and 3rd day after being bitten, patients can start developing symptoms. Also, the virus can be identified in the blood around 5 days after the patient has been infected or has received the infected bite. Now the acute phase, most of these symptoms will subside within about a week. The acute phase generally will last up to about 10 days. And then there's a convalescent stage, which is as the word says, a short period of recovery. But there's also a chronic phase where some patients may experience a relapse that may last for months. And this relapse is mostly seen in patients who are older than 40 years of age and with certain underlying diseases.
Dr. James listed a specific group of people who may be placed at serious risk if they contract the disease.
For example, the newborn, the very old, patients with diabetes mellitus, asthmatic patients, patients with heart failure, kidney failure, liver failure, chronic rheumatic disease, and sickle cell disease patients. So these patients, if they contract chikungunya, can be at serious risk. Now in terms of the management, the fundamental part of it initially is prevention. Prevention from being bitten. And this is not just for the person who is well, but for the person also who is infected with chikungunya, because the mosquito has to bite somebody who has chikungunya, take their blood and literally inject it into somebody who is basically well.
And according to Chief Laboratory Technologist Claudette Williams, there are at the moment 14 samples also from Beckway to be sent to the Caribbean Public Health Agency, CAFRA, in Trinidad and Tobago to be tested for the disease. Cancer, diabetes and cardiovascular diseases are said to be the leading causes of death in St. Vincent and the Grenadines. That's according to the 2012 Monitoring and Evaluation Report by the Ministry of Health, Wellness and the Environment. Speaking at a lecture last evening at the Glynn Baptist Church on chronic non-communicable diseases, focal point for these diseases, Dr. Rosmond Adams gave an overview of the leading causes of death in this country.
Malignant neoplasm, and this is a fancy name for those of you who don't know for cancer. The second is ischemic heart diseases, the third is diabetes, and the fourth is cerebrovascular diseases, which are cerebral, speaking of the brain, and vascular, the blood vessels. So then, what is NCDs? We've been hearing a lot of NCDs, CNCDs. NCDs stands for non-communicable diseases, and CNCDs, sometimes we say chronic non-communicable diseases. Normally, non-communicable diseases are diseases that are chronic. So sometimes we leave off the C in front and we just refer to them as NCDs, which are non-communicable diseases, because most of them are chronic. So what are non-communicable diseases? They are a set of diseases. They are not only one disease. So that is why we have an umbrella. They are like, we can put them in one basket or under one umbrella, and we refer to them as non-communicable diseases because they are diseases that cannot be spread from one person to another, and they develop over time and can be chronic and long-lasting.
Dr. Adams said NCDs are caused mainly by lifestyle choices, genetics, or by the environment.
NCDs are largely preventable by means of effective intervention that tackle shared risk factors. And these risk factors that contribute to non-communicable diseases are tobacco use, unhealthy diet, physical inactivity, and harmful use of alcohol. These non-communicable diseases are not only a health problem, but they present a developmental challenge to countries like St. Vincent and the Grenadines.
Meanwhile, Dr. Adams said modifying bad health lifestyles can help prevent chronic non-communicable diseases. According to him, some lifestyles persons live pose threats to their health in a significant way.
These are the ones that are normally linked to lifestyle, and they are unhealthy diet. This we can change, this we can work on, this we can tackle. The second is high blood sugar levels. This we can do something about. The next is smoking, high blood pressure, high cholesterol, physical inactivity, overweight, excessive use of alcohol, and stress. So all these that I've called the modifiable risk factors, we can change all of these, we can work on all of these, and modifying them, changing them will improve our health.
In other news, a young lady of Rosebank with a very severe skin disease will this weekend move into her new home provided by the government of St. Vincent and the Grenadines. The young woman gained national attention following the December 24th trough system, which damaged her home and caused her skin condition to reappear. Speaking to members of the media on Wednesday, Prime Minister Dr. Ralph Gonsalves says 8 houses from that area have been relocated to Cumberland and are 95% completed, with the one belonging to the family of the sick young lady furthest advanced.
That is the lady, the young lady who had a skin disease from the time she was a baby, and who is housed at through the instrumentality of Trinity. This morning I was in touch with Mrs. Ned because I had asked housing if they at Cumberland they could expedite that one, because the young woman has to come from where she is being housed. An assistant professor at Trinity is coming back, and who is going to occupy that accommodation sometime next week. So before the end of this week we're supposed to have that completed, as you promised. So I was in touch with Mrs. Ned this morning, because we have to make sure that the furnishings are in order and everything of the sort.
The poor result of an evaluation of craft makers here by the International Cruise Association has led to the signing of a craft enhancement and business planning training to support human capacity building in the public and private sectors. The project, funded by the Organization of American States, saw the official signing today between the Ministry of Tourism and the Central Planning Division. According to the Permanent Secretary in the Ministry of Tourism, Sports and Culture, Laverne Grant, the $1 million EC project seeks to target unemployed youths, women, entrepreneurs and risk groups in developing their craft. She said that a survey conducted by the Florida Caribbean Cruise Association Economic Impact Analysis revealed poor results in craft development in this country.
What came out of that survey is that although our sites and attractions we rated highly in those areas, our craft, we didn't get favorable ratings on that. And because of that, we always look at ways in which we can help out the craft and the craft sector. This project will be implemented over a 2-year period, and commencement date is May 2014. As Mrs. Glynn indicated, the cost is US $398,000, of which St. Vincent and the Grenadines will receive $39,077.
Grant added that the project put forward by 3 governments, including St. Vincent and the Grenadines, was so well received by the OAS that it was extended to other islands.
This project was originally presented by the St. Vincent and the Grenadines Ministry of Tourism, Sports and Culture on behalf of the following participating countries: St. Vincent and the Grenadines, Grenada and Dominica. After we submitted it for consideration for funding, the OAS found it to be an excellent project and decided that we should extend it to the other countries. Hence, the inclusion of Jamaica, St. Lucia, St. Kitts and Nevis, and Antigua.
Meanwhile, the OAS country rep, Melene Glynn, said the project inauguration today is a demonstration of our organization's commitment towards the integral development of this country. She added that with tourism as the main income earner, all should be done to enhance the sector.
The project focuses on the area of tourism, an important foreign exchange earner for many Caribbean countries, including St. Vincent and the Grenadines, but one that has been and continues to be under pressure from the global economic downturn. We all know that potential visitors who have access to discretionary income are being more discriminating when and where they use it. If St. Vincent and the Grenadines is to maintain and increase its share in the current competitive globalized environment, it must continually seek to enhance, diversify, and even reinvent its product in order to continue attracting visitors to these shores.
And Director of Planning in the Central Planning Division, Laura Anthony Brown, pointed out that the craft enhancement and the business planning training is in keeping with the government's National Economic and the Social Development Plan of 2013 to 2025.
I believe based on having this document in my hand and having also read the project before its submission to the OAS, I can see the connections between both sets of documents. Because if this is happening and craftspeople now know how to enhance their product and how to put it out there on the market, you can certainly see that then they are creating an income for themselves. And if they are creating an income for themselves either by producing the things themselves and perhaps too even employing one or two other people in the process, or by being themselves better equipped so that they have the appropriate skills to become employable, I am sure now that you can see the connection.
21 additional primary schools here have been included in the cohort of institutions that are undergoing training in the Child Friendly Schools Initiative, the CFS. The initiative by the Ministry of Education is being funded by the United Nations Children Fund and targets primary school teachers and head teachers. Speaking at the second phase of the implementation training session, Senior Education Officer and local CFS focal point Elizabeth Walker listed the additional schools which were selected to participate in the initiative.
The 21 new schools are Georgetown Government, Fitzhugh Government, Lomans Leeward Anglican, Stephanie Brown Primary, Barry Government, Layu Government, Sandy Bay Government, Fairhall Primary, Diamond Government, Lomans Windward Anglican, Argyle Primary, C.W. Prescott Primary, Kingston Preparatory, Sign Hill Government, Brighton Methodist, Stubbs Government, Connery Government, New Bronx Primary, Dixon Methodist, Pamela's-Bow Primary, Langley Park Government, and we also have with us South Rivers Methodist.
Chief Education Officer Luan Gilchrist highlighted that the program, which originated in India, has been deemed a success in making educational institutions more child-friendly.
This initiative has its origin in India, where it was intended to facilitate and support the participation of girls in the educational process. However, since it was so effective in achieving its aims at inception, it was modified and extended, and it is now implemented in schools throughout the world.
The participants at the three-day training sessions on the Child Friendly School Initiative were reminded that information is best used when shared. Chief Education Officer Luan Gilchrist advised the participants to return to their schools and train other members of the staff in an effort to provide quality education for all.
Remember that this is a workshop for the training of trainers. Therefore, your role has been clearly identified for you. You will go back to your schools and spread the evangelism of the Child Friendly Schools Initiative. Remember also that the Child Friendly Schools Initiative encompasses a wide variety of aspects of human development. In the Ministry of Education, we're responsible not only for students' academic development, but also for their spiritual and social development.
Facilitators of the CFS training sessions include UNICEF consultant Anela Ruban, Deputy Chief Education Officer Beverly Neptune, and Senior Education Officers Maureen Williams, Joycelyn Blake Brown, Aldia Dyer, and Elizabeth Walker. 13 schools participated in the first phase of the initiative. Meanwhile, Chief Education Officer is calling on teachers to foster positive attitudes among their students. Gilchrist said the teachers can regulate their students' behavior through positive reinforcements.
Do not resort to the strap, to the ruler, to the belt. That is not what we're advocating. Help the students to regulate their behavior. Help them to modify their behavior through positive behavior management strategies. Find what is in each child that is good, that is positive. Show that child what in him is good, what in him is positive. Help him to build on that, to develop that. Don't use negative language. Do not let the children think of themselves in a negative light.
In other news, the 2014 National Gospel Festival will climax on Sunday night, showcasing some of the best talent by gospel artists in this country. Coordinator Michael Peters told SVG-TV News that the festival, which started in 2003, remains true to its objectives and the level of participation remains consistent over the years, with wide representation from various communities throughout the country.
Persons are always eager to get an opportunity to demonstrate what talent God has blessed them with. And this year, we brought back one of our major programs, which is a night of dance. Because we felt that dancing needed another boost, gospel dancing needed another boost, another shot in the arm. And that proved very successful. We had 15 dance groups on stage, and it was indeed a good night of dancing. And on Friday night, that's Friday night this week, we're having a night where we are encouraging persons who write songs, original songs, to come to Faith Temple Church in New Montrose and be part of a new program which we are developing to encourage people to continue to produce more gospel songs called Praise Him in Song, Sing a New Song.
Peters thanked the Vincentian public for embracing the festival, which he says continues to hold its own in all aspects of the performing arts.
The attendance has always been quite good. It's in the month of April. It's a month that has other major activities taking place, such as Easter Valley, Union Island, Beco Easter Regatta. But the festival still continues over the years to hold its own, and persons have been coming out in significant numbers and supporting the festival over the years.
The chairman, I think at the opening of the festival this year, the chairman basically called on the churches to take ownership. He lamented what you started off saying in terms of the financial aspect of it. How has that been going in terms of, has churches basically, say, yeah, we're ready to be a part of it, or we're gonna, see whether or not we could take it over?
Well, the festival has always been of the church, for the churches, and by the churches. What the chairman was saying, he would want to see a greater input and involvement from the churches. The festival really started by initiative from the Ministry of Culture, so there was a significant amount of government push behind it. In terms of going forward, the chairman was asking for the churches, to take more ownership of the festival, but they've always been a very important part of the festival.
Peters used the opportunity to invite Vincentians to Victoria Park this Sunday for the wrap-up of the festival for 2014.
Gospel Fest has always been about the family, kids under 12 free, so make sure everybody come down to the Victoria Park this Sunday starting at 6 is the SVG National Gospel Showcase. We want to see you there. Come for a tremendous time of ministry and blessing.
Some carnival news now. The finalists in the Best New Song competition scheduled for the launch of Vincy Mass 2014 have been released by the Carnival Development Corporation. The 6 finalists competing in the Calypso category are Alpheus Observer Duncan with the song If Calypso is Dying, Alexis Lexi Joseph, Sunday Evening Bassa, Glenroy Sule Caesar, Facts of Life, Noel Defo Castillo, Thanks, and Vivian Icom Miller, Body Parts. The finalists in the soca category are Orlando 6 Crazy, Foster, It's Carnival, Orella Queen Bee Beach, Walk Up Time, Godwin Gow Billy, that should be Godwin Billy the Gow, Hornerman, Cleopatra Henderson, Nago Home, and the Tamisha Nichols with Come to the Stage. In the Raga Soca category, they are Travis Lynch, Orella Beach, Tamisha Nichols, Cleo Henderson, and Mikey McDowell. All finalists are asked to attend the meeting tomorrow at the Victoria Park from 5 p.m.